Hello, viewers. My name is Balam Nwandinda Menas and a community health advocate. Today, the 17th of October 2025, I am visiting Mr. Charles and Jessica's family to ask them and discuss how they are living their life in this poverty situation. This is one of the families that are poor in this community, and I have been here. We have discussed quite a number of issues. Majorly, we looked at issues to do with food or feeding, healthcare, children's education. They shared with me what is happening inside their house. We looked at the beddings and the beds, protection from mosquitoes. We looked at the issue of mosquito nets, and they also shared with me about the issue of lack of clean water around. So I'm reading the summary of what they have shared with me. First of all, Mr. Charles is blind. He has eye problem. He cannot see. And the wife, Jessica, she has been unwell for some months, since July, and she reports that she was hospitalized for 2 weeks in a government health facility. Mr. Charles, because of his eye problems, he has been unable for quite a long time to fulfill his duties, obligations as a parent. He does not work, and so he is completely unable to provide for his family. On the other hand, his wife Jessica is the one who has been taking care of everything in this home. But because she has been sick as well, and as you can see, she's emaciated, now the situation became worse. So under the issue of food or feeding, this family only depend on the masses of those who have some food. To get food, they have said they first do what in our local language we call okushaka. That they have to first work, go out, look for work, especially in families that do have some food. So they work for food. And there is a big issue here. They don't have land. Where the house is seated, that is their only land they have. So I think that could be one of the major reasons why they don't have what to eat. And they have reported that rarely they eat 2 meals in 24 hours. Rarely. Most of the time they have slept hungry, and most times if the mercies of God visit them, they can get food only once in 24 hours. They report that about 5 times they have slept hungry in a month. That's the summary. About feeding or food. We talked about healthcare. Mr. Charles is blind and has been blind for many years. He has been battling the issue of peptic ulcers, but he reports with good news and appreciation that the peptic ulcers are no more. And we give thanks to the Bromeliad Foundation that recently was able to help with medication, and Charles now here, he can testify that really the foundation has done a miracle in his life. Like I had said, his eye problem doesn't allow him to do work, so he is always here at home and unable to provide for his family. So currently, Jessica has an issue of cough. She has been coughing since July. She has a productive cough. Especially, it is worse especially in the morning. And she also has reports of abdominal pain. She says she always feels hunger despite eating regularly. So I asked her whether she has tested going for a TB test. She hasn't, because she doesn't have money. She doesn't even have transport to go to the nearest facility where they can do the sputum testing. We also looked at children's education. They have 5 children. Fortunately today they are at school. They are all at school, but they are on the mercies of the community members who are able, and also they work, especially the wife. The wife has to work for the school fees. They don't have uniform. They completely do not have uniform. That one I'm sure, because I have always come here and it has always been reported to me. Getting scholastic materials is another big challenge. Everything that happens here, whatever it is, let's say anything to do with money, feeding, clothes, they have to first toil to get money to buy those essentials. I asked them deeper about the picture of the inside of the house. I asked about beddings. The children have no blanket, they don't have bed, they sleep on the floor, and with no protection from mosquitoes, especially these ones that transmit malaria. They said only one mosquito net was donated to them 2 years ago, and I asked them to give me permission to look at where their children sleep. There is a video, you will see it. The situation is just terrible and heartbreaking. This is Charles and Jessica's family in Rubabo B village, Nyashana sub-county, Lukungiri district, southwestern Uganda. My name is Balaam Niwaninda. I'm a nurse and a community health advocate, and I'm working with the Bromeliad Foundation, which is a Canadian-based NGO that is soon coming here to help these people get out of poverty. Thank you so much for watching, and please visit www.thebromeliadfoundation.com to learn more about the foundation and how a blessing it will be for these poor people in Uganda and even outside Uganda. Thank you. So nice. Nice na kusinza video namara agere kujya muri plan yo kuronda mu akamera mere munja ka keso tingira kujya mu kurebe akamera kujyaje kuya kasinga. So shayo na pasta munyine
akasinga kakamunyu
shayo na pasta munyine mara kujyaje maza kato